Hi everyone, my name is Kelsey. This week we had the opportunity to learn about informed consent. Remley and Harley 2020 relate informed consent to client autonomy. This autonomy allows the client to be in control of their treatment decisions. Therefore, it is important to have a strong informed consent document, which will allow the client to be aware of the services that they will be receiving. The informed consent sample that I have chosen is from LifeWorks Resources in Tennessee. When reviewing the sample, there's a lot of correlation between the 2014 ACA Code of Ethics recommendations and the sample itself. To begin, the sample opened the document with an introduction to the counseling service by stating both the counselor and client's roles. This was noted as a counselor obligation in the ACA Code of Ethics. Following this, the potential for risks when receiving counselor services was noted. According to the ACA Code of Ethics, it is important that informed consent not only describes a client's rights to confidentiality, but the document must also explain the limitations. LifeWorks Resources states the exceptions to client confidentiality in a numbered format that is clear and concise. The Tennessee State Board Rules and Regulations, Chapter 04500118, states 4 points regarding the mandatory release of client records. The informed consent document from LifeWorks Resources concludes clients' rights and responsibilities by discussing how patients can request and receive medical records. This document states the chapter and section of the Tennessee State Board Rules and Regulations, as well as lists the 4 points verbatim. Another part of informed consent that LifeWorks Resources has stated in their document is payments and fees. The ACA Code of Ethics states that this information is necessary in an informed consent document. The form states insurance and self-pay information. The form also explains the client's financial responsibility for each type of payment. LifeWorks Resources has also outlined details for any other fees, such as court-ordered or attorney evaluations, drug screens, standardized testing or assessments, letters or record summaries, and attendance in court. To conclude the general information, this informed consent sample tells what to do in emergency situations, which includes the LifeWorks Resources number, as well as the local crisis number for any serious circumstances. To conclude, the informed consent sample states client expectations. The patient is then asked to sign, as well as acknowledge the following: a copy of LifeWorks HIPAA that has been made available, that the client has read the full informed consent document and client rights and responsibilities, that the client agrees to pay 100% of the charges and the price in the event of not giving a 24-hour notice, and lastly, the ability to receive messages electronically. By requiring a client's signature regarding these specific points, LifeWorks Resources informed consent document has met most of the ACA Code of Ethics recommendations. Although LifeWorks Resources informed consent document aligns with most of the ACA Code of Ethics recommendations, the form does lack any specific techniques and procedures. Instead, the form states that each therapist uses a variety of approaches and that they will be flexible with each approach so each client's individual needs are met. This ambiguous description may be due to the form being used for a variety of counselors versus one individual counselor. Also, LifeWorks Resources informed consent does not have any guidelines or information on continuation of services in the event of incapacitation or death of a counselor. This is necessary information from the ACA Code of Ethics that is missing from this document. And that is going to conclude my video. Thank you guys so much for watching.